Good afternoon, everybody. Hope you're all well and enjoying the conference. Welcome to this NHS Careers Session with myself. Next slide, hopefully. So I'm Leon Pietrzak. I'm Youth Development Manager covering the northwest of England. And I sit in an organisation called Health Education England. Within that is what's called the Widening Participation Apprenticeships and Vocational Team. With my colleague who is about to introduce herself as well.
Yeah, sorry, you can't see my video, I don't think, at the moment. So my name's Keiler. I'm the Programme Support Officer for the Education Transformation Team over at Health Education England. And along with Leon, I work in the Widening Participation Team, supporting widening participation, vocational learning and apprenticeships and all sorts of youth development activity across the Northwest.
So yeah, a little bit as we're going to move through this session today, it's in two parts. The first aspect is looking at NHS careers and the variety of roles and careers available. And then the second part, later on in the session, we'll be looking at what we need to include in an application form that involves your values, behaviours and attitudes when we're completing the application form for a variety of different roles. But before that, in terms of gaining an idea of who we're actually speaking to, just a little bit about myself. I've been working for Health Education England for just over 15 months. To be honest, I'd never thought of a career in the NHS, as I originally started out as a sports coach, youth worker, and predominantly most of my roles revolved around working with young people to do with sport, and sort of evolved as the years have gone on around careers, employment and support, and really very, very passionate about encouraging more and more individuals into the NHS, and especially young people. And as Keiler mentioned, we're doing a lot of work with a variety of age groups. So with that in mind, if you don't mind, on the Slido, if you downloaded it, hopefully, could you just tell us your name, your age, and what interest you have in the NHS? If you're struggling with Slido, by all means, put it in the chat. So both Keiler and I will be watching both. But it'd be great if we could on Slido, that'd be amazing. The code should be on the screen. Hopefully Keiler's showing it. It's So
Keiler, I think you've stopped screen sharing.
Yeah, I'm just going to share the Slido one now. So I don't know that you can switch. Can you switch between the screens? So I'm just showing, we've got Alia, and she's 16 and she's interested in cardiology. I think you should all be able to see that screen.
There we go.
We've got radiography. Okay, we've got children's nursing.
Lewis, if you can't get through on Slido, just put it into the chat. Just your first name, age, and what you're interested in.
We've got any more? So we've got 3 at the moment so we've got dietetics, we've got cardiology, children's nursing and radiography so far, and we've got 16, 20, 19. So we are slightly at the top end of the age range. So the job application stuff will be really relevant. And we've got someone 14, I don't know whether that's Heidi, it might be Alia. Internal medicine.
Lovely. If you keep just putting through that information, that's great. And Keiler and I will keep.
Okay. Yeah, so we've got some neuroscience, surgery, internal medicine, midwifery. So really, really lots of variation there. Do you want me to stop sharing and go back, or to the...
Yes, please, Keiler. Yeah. But say individuals can continue from that perspective. Okay, so wow, what a diverse range of careers that you've mentioned there, and that's a fantastic, great start for the session. So part of this session, as I say, in terms of a number of you, I've already done a lot of research around the careers that you want and are highlighting a variety there. But with that in mind, what we wanted to do is just a quick little activity just to test your maths on a Saturday afternoon, and basically give us a rough number. Once Keiler's got through to the next screen there, okay, give us a rough number of how many different career options you think there is in the NHS. So we're looking for a particular number of how many you think there are. So once again, you can either share it through Slido or you can put it through the chat. But if you could give us a rough idea of how many different career options you feel or think are available in the NHS.
Sorry, I'm going to flip back to Slido now. It's not that easy to do.
Sorry, Keiler.
If they've been they're doing it in the chat box, Leon, we'll maybe do it in the chat box.
All right, yeah, that's okay. That's all right.
Do you want to talk? I can't see the chat box, so if you want to let me know.
Yeah, I can see the chat box, and quite a few of our audience are getting it right now.
We've got, oh yeah, I can see 400, 300 plus, 350, 400.
Yeah. Definitely, a few more. We'll give it another 30 seconds to see how we go in terms of how many more we've got. That's 300 from there. Yeah. Hi, Jasmine. Hi. We're just guessing how many variety of different careers there are available in the NHS. So we're just looking for a rough number. And if you've not had time to download Slido, just put it into the chat. And you'll see a number of various numbers. Okay, Keiler, what do you think? Shall we flip back? Okay. Okay, we're talking to a well-informed audience because there are a number of you got the question right. And as you can see there, a little bit of a Harry Potter fan. So from that perspective, there's 350 plus careers available in the NHS. As sort of outlined at the beginning in terms of career of Keiler and myself, obviously we make up a variety of those different professions. Say I'm a youth development manager within the NHS. And then from, I'll say, Keiler's perspective, she supports that aspect and the variety of other roles within our team as well. So we make up those 350 plus. Okay, moving on from there. Keiler, do you want to jump over to the next slide for me? Okay. So building in what a number of you have already presented with us in terms of the variety of different careers that you are interested in today. This, again, is just a selection of the different or the main themes in terms of the variety of different roles that you mentioned that they would sit under. There's a variety of different roles that you would see within pharmacy, you would see within healthcare science, you would see within nursing, you would see within healthcare support, and then some of the newer careers coming online around health informatics, and then obviously from the dental team, the variety of different roles that's available with that. Some of you may not be aware of the variety of different opportunities that are presented within health, public health. And how that has a diverse range careers that all interlink into the variety of different professions that we're talking about today. again. So I think some of you mentioned about the ambulance service and the variety of different roles and entry roles that are available in the ambulance service. And then from our perspective in terms of management and the variety of different roles that are non-clinical that we'll also look to discuss further on as we move through this presentation. Keiler, you got anything to add there?
Yeah, just that obviously we've got the wider healthcare team. So generally these would be non-clinical. So these would be things like your estates team, so the people who keep the hospital running, the psychological professions. It's always important to mention that the psychological professions and all the professions, they're always growing. So recently we've had the trainee nurse associate addition to the nursing team, which is sort of your level underneath your nurse, but that's an apprenticeship route. So that's a really great route for people who maybe are leaving college, don't want to go to university, or want to go straight into an apprenticeship. It's a really great access route. And they're also doing, another thing to mention is the nursing degree that's now available. So the registered nurse degree is available. You will be able to find any of those kind of opportunities online, whether that be on NHS jobs or if you're going onto the NHS, the local NHS websites, you should find the opportunities on their website. So there's always new roles and new entry routes into roles to consider.
One of that to add on as well is obviously the Health Careers website and helpline is available. And we can put some more information, and if any of you are interested in that, in terms of any of the roles and entry routes and so forth, because obviously the variety of different careers that you're all coming up with today, you can type that into Health Careers, and there's a variety of different ways and information that can be provided to you in terms of entry routes, videos, examples of the variety of different careers available, and there's also case studies to give you a taste and sample of the variety of what people are saying about those particular roles. I mentioned, or a number of you have mentioned physiotherapy. A lot of you are interested in sport and exercise on here today. So there's a variety of different roles that would relate within our allied health professions that you may want to have a little look at as well.
Sorry, someone's put, why is it all black? Is this, are you able to view the slideshow? Is everybody okay? Is just double checking because somebody's asked why it's all black. I'm not sure if they can see that. Monica, clinical coding, there is an apprenticeship in this. You can see, okay, that's fine. There is an apprenticeship in this. So that's something to, I know they're looking into clinical coding apprenticeships at the moment. So the next slide was just basically, you all seem to really have a good understanding of what it is that you want to do. But the next slide was really just to highlight how many people are involved in one single person's journey through to maybe injury back to health. So this is a view of Danny. Danny's age 16 and loves football, and unfortunately he broke his leg playing Saturday League football. He was taken to hospital in an ambulance, and you can see there the number of people involved in that. So you've got your paramedics, your emergency medical technicians, your mechanics who keep the ambulance running, your call handlers who take the calls, and your emergency medical dispatchers. He arrives at A&E and he's triaged by the nurse who assesses the leg. So there you've got your receptionist, your security, your domestic assistant, and your triage nurse. He goes and has a consultation and he has an X-ray. So I think we said we had some radiographers, people who were interested in radiography in the crowd today. So there you would have seen A&E doctors, consultants, A&E nurses, radiographers, and radiography assistants. He's then gone to have his bloods taken, and the bloods go off to the labs. Obviously, we've got all our healthcare scientists who are involved in that process. He's admitted to surgery, and he would have been seen by a theatre technician. I don't know whether you're familiar with what's called an ODP, which is an operating department practitioner, which sits under our allied health professions, a surgeon, and an anaesthetist, and a theatre nurse. He's taken onto the ward by a porter, and obviously we have to feed him, so we rely on the chef to create the meals for us. He's then discharged from hospital and he's taken home. Now, he's taken home by a patient transport service driver. So that's another person that's not the same as the ambulance, but it's part of Northwest Ambulance Service here in the Northwest. So that's his inpatient journey. In his outpatient journey, so once he's been sent home from hospital, he starts his recovery. And this is where a lot of our AHP team really start to work with him. And he'll see somebody such as an occupational therapist, a physiotherapist, physiotherapy assistant. He'll also see, when he goes to his GP, care coordinators or GPs. He might see the pharmacist if he's given a prescription, a pharmacy technician, and a practice nurse to remove his stitches. He begins the road to recovery with the support from an occupational therapy support worker. So they're all the people who've taken part in just one person's journey, and that was for a broken leg. So something that happens really frequently. In addition to all of these people, there's actually all of the people that sit in the background. So I'll put a list of these just so you can see just how many of us get involved in patient care. So you've got things like HR managers, they manage the staff and the work in the hospital, the staff and the workforce in the hospital. Payroll, they manage the pay for all of the staff in the hospital. Recruitment, they recruit the people that work in our hospitals and our doctors' services, primary care services. Finance and procurement, they ensure that everything in the hospital is available to ensure that the hospital can run and it's sourced properly. Training and development support the development of our workforce. We've discussed a little bit earlier about the facilities and estates team. So there are things like your joiners, your electricians, your mechanics, your medical device technicians. They make sure the hospital and the equipment is safe, clean and fit for purpose. And then you've got the wide range of other admin and clerical services, which actually myself and Leon sit under, which is everybody else who does all sorts of admin to support the workforce, to support people thinking about careers in the NHS, to support projects, quality assurance, improvement, or general day-to-day administration and running of the services. And then obviously your IT support to ensure that the systems are safe, secure, and the information is transferable between departments. So based on all of those, sort of taking into consideration all of those people that were involved to meet with Danny's journey, we'd say that approximately 70 different roles had an impact on Danny and his recovery journey. And actually more than 50% of these were not clinical. So they may never see Danny, but we all have a role to play in the patient journey. Even myself and Leon, who may never meet some of the patients, will have a role, because if we support you to think about a career in the NHS, essentially, and you move into the NHS, we have helped that patient. Even though it's indirectly, we all support the patient journey. And that's the most important thing, I think, to think about when it comes to thinking about careers in the NHS. You may not have direct patient access, but you will always be focused on making that difference. I think this is you, Leon.
Oh, sorry, yeah. So, sorry, I've just been answering a number of questions in the chat, and it's fantastic. And we're getting some really specific questions through, Keiler. So what I have done is put in a number of links to support you to access a variety of those, because a number of them are very specific questions. And I think that our National Health Team's support line and website would be able to answer a number of those in more depth after this session today. So hopefully, if you take those links out, you'll be able to then access the information or click on as we're speaking through. So obviously, building on from the last couple of exercises, we just wanted to showcase, and a number of you have put a variety of different careers that you're interested in, and then you've also put alongside that, not so sure. So with that in mind as well, whilst there's a variety of set careers where you say talking about being a nurse or a particular other profession, there are, as I say, a number of roles that are associated with that. Now, what we also are interested in is, as we move forward, your values, behaviours and attitudes that may link to one of these keywords that you can see on the screen. And within these words, there's a variety of different roles. So if we were to look at, if any of you have any interests in these, there's a variety of these roles that would link to that. So, for example, if you were interested in music, within our allied health professions, we would look to be a music therapist. And then associated with that, you would have a drama therapist, you could be an arts therapist. And when we're looking at the aspects around social media, in terms of our communication teams, both in Health Education England, in the NHS and each of the trusts, they have a communications team where a variety of roles would take place as well. And then from the other perspectives, in terms of the other roles that Danny came across, where they never actually saw Danny, but in terms of cooking, in terms of the caterings teams, and then the variety of aspects around, some of you have talked about physiotherapy and the related outpatient roles that would tie into the exercise, and looking at the variety of other factors as well. Keiler, have you got anything else to add on that?
Yeah, just obviously looking at all of these, I think we've got a question in the chat box, but it's I've actually gone off the chat box, but somebody, okay. I think it was Lewis had asked about the areas of extreme shortage in the NHS. Okay. And I think there's a massive, I don't know whether you are all familiar with it or you're not yet, but there's a massive push in nursing. So the government have actually given us a figure of 50,000 new nurses, and we are, I think it's by 2025, we are working towards getting those through lots of different routes. So things like return to practice, through things like the new nursing apprenticeship, and through things like increased placements. So a big area for development and a massive chunk of our workforce is always going to be nursing. So if it is something you're looking at, you want to really think about where would I be best placed and what is an area of need. Nursing is always going to have a need because it is such a big workforce. Other areas of need though are GPs, GP services, with, doctors, there's some AHP professions, things like diagnostic and therapeutic radiographers. So there's lots of different areas of need. We're such a big organisation that we will always have a need for new workforce because people will retire. So naturally we will need, but if you're thinking about areas where there's a definitive need right now or what to choose at university and you've got an interest in clinical, then nursing may be your option. Or if you are interested in medical, if you want to do something that's more allied health professionals related, there's 14 different types of allied health professional. So there is such a wide range of experience and opportunity in the NHS. There really is something for everybody.
We're getting some questions as well, Keiler, just in and around some specifics in terms of qualifications, okay. And sort of looking at, the sort of pathway as to do with the subjects that they're taking. I think that we could talk a little bit about that later on in the session around the application form, in terms of specifics around that, because in terms of obviously the subjects that you've chosen would all link into your what you want to do, what you're interested in, and how that marries up towards a future career. And I think we'll talk about a bit more about that in the application stage, which is coming in the next part, which is not long away. Yeah?
Can you see the screen now? Yeah.
Yeah. I'm afraid. Okay, so just building on that, and in terms of the chat that a number of you have asked about, alongside obviously qualifications and the variety of different route ways available in the NHS, one of the core aspects of, we don't accept CVs. We obviously are all based around a values-based recruitment. And what that means is that we would also look at your qualifications through your GCSEs, through your A-levels, through college, but also the type of person that you are, and what makes you you. And in terms of the NHS, these are the values that we live to day by day, whether it be clinical or non-clinical. Each and every one of us have our own values, our NHS values, and then within that, the trust themselves would have a number of values. But in terms of life experience, a number of you may think, well, I might not have as much life experience as other individuals, or I may not have done certain things. But one of the key aspects that Keiler and I want to stress today is just to really look at the things that you've been doing in the last 12 months, over COVID. What type of things are helping you to strengthen you as a person, and the people around you? And that can be processed into your application form to demonstrate your values. And as you say, in terms of respect and dignity, one of my key factors for my son, who is coming up to 8 years old, always says, my favorite one is that everyone counts. And how would you demonstrate that you would marry that up within your application? And it's something that we really want you to think about every day. And in terms of, whilst you move through to your A-levels, to college, to university, whichever route way that is best for you, these values are very, very important in the application process. If we have any further questions on that, just put them in the chat box. Otherwise, we can move through onto the application process. And everybody goes quiet on values.
Okay, so it's really important, obviously, you will consider applying for, you'll be involved in the application process. Even if you go to university, you come out as a qualified individual, you will have to go via the NHS application process. This is what we do for all roles. And as Leon mentioned, we are very heavily values based. So whilst we look at your qualifications and your experience, we also want to see that you've got the values that fit with the NHS, and that you're passionate about the same thing. So like, as Leon said, that everybody counting. So we'll have a quick look at the application process. I don't know whether anybody's actually familiar with the NHS job site, but these are some sort of top tips that we thought we'd extract. So job search top tips for us was to always use the NHS official website when searching for NHS jobs. This website gives you the opportunity to see a range of jobs from a range of NHS trusts. So across nationally, there are so many NHS trusts. In the Northwest alone, that we have 35, which is where myself and Leon are based. Now, each of them will advertise on NHS jobs, so it's a really great place to go if you're looking for jobs or if you're looking for apprenticeships. We were talking this morning about an apprenticeship that's been advertised this week for an emergency medical technician, which is a great opportunity for someone finishing college. Use the advanced search criteria and be specific about what you're looking for and where you want to work. Always read advertisements, job descriptions, trust and NHS values, and the person spec before applying. Yeah, Lewis, if you've done charity work or if you've done any kind of work experience that's really been relevant, or if you've been doing anything during COVID, that's great. sorry, just seen that come up in the chat box. Always read the advertisement. Always do your research. Lots of NHS job advertisements use technical and medical terminology. So if you don't understand the information, just do some research before you're applying. We've got a question here. How can I show that I'm serious about the NHS Constitution? If you look at the values, it's how you can show that you do things that underpin these values. So it might be when it comes to that everybody counts, that you do something at school or college about inclusion or equality and diversity, and really appreciating diversity. And those kind of, maybe you're in support groups, maybe you're championing something in college, maybe you do it in your own time. Things like everybody counts, or showing caring and compassion, and those kind of things you may do through volunteer work. Yeah, if you work in a tutor centre, that would be, you know, if you're supporting people in any way, it's always going to be relevant to the NHS. So this is a snapshot of a couple of vacancies that I took off the NHS job website a while ago. You can see that these are both entry-level roles. They're band 2. The NHS works in bands for most roles. There's a slightly different banding system for the medical roles, and slightly different banding systems for executive roles. But the majority of the roles work on band systems. So these are entry-level band 2 roles, which you can apply for when you're in college, leaving college, when you're leaving full-time education. You may be required to have previous experience. However, work experience or volunteering is a great way to develop this. And we know that volunteering during COVID is really, really difficult. But there are lots of webinars and virtual things that you can sign up to develop your experience. We had a really good work experience week that was done virtually. And that was an amazing opportunity for people to get experience. So let's just look at the next page. So key skills required and responsibility. So I've taken these out of the job description. What I did is pulled some key topics out. So for the receptionist, it looked at things like reception duties, taking accurate messages. So whenever you're thinking about applying for a job, you have to read the person spec and the job description. You have to pull out what they are looking for. And for the assistant technical officer, they're asking somebody who can accurately prepare worksheets. So you have to pull that out and evidence how you meet that. These are the things that are important with this role. And this is how you will get into interview. These are graded applications. And if you meet the criteria and you evidence you can meet it, you will get shortlisted, but you have to be explicit. And this goes for when you're qualified as well. The process will still be the same. You'll always have to explain how you meet the criteria.
Okay, we're getting lots of questions around. Obviously, we're mentioning volunteering, and we're mentioning a couple of things. Obviously, key aspects at the moment that Keiler and myself and all the trusts are looking at how we support young people at this point in time. Around, obviously, there's no physical placements, so volunteering is difficult, and obviously having work experience is difficult. So in terms of the variety of ways that you can look to maintain your interest and build your application forms, there's a variety of online courses that you can access, and a large portion of them are free. And I've put a number of links in the chat box for you to click in there to look at these variety of different courses that you can do in your spare time, that demonstrate, and you can put in your application form that you are taking part within these 2-week, 3-week online courses that a number of them provide you with an attendance certificate and demonstrate that you have put hours towards the application and your interest within that role. Because obviously we can't physically volunteer in certain situations, certain areas and certain things, we've got to look at the different ways that we can ensure that we are recommending and showing that we can fill out those applications to do with medicine. There's a variety of specific, not work experience specific, but courses that some of the universities would recognise in terms of hours spent on that course. And I'll put them in the chat box as Keiler continues.
And also what's important to mention is you may think that some things that you are doing that you're volunteering to do are not linked or that they're not relevant for things like maybe supporting on a food bank or supporting locally in your community. It's not a direct health link. However, it's a direct link to the values that underpin the NHS. So anything that goes to show you in the community supporting people, anything like that you can pull from, as long as you can explain why this has made you a better person, how and what you do to improve other people's lives. You're always bringing it back to improving people's lives, and that's what we're here for. So in terms of the application process, the most important thing when applying for any job is to really look at the person specification. The person specification outlines what the employer needs you to be able to do or have in order for them to offer you an interview. It has essential criteria and desirable criteria. And each thing that they've listed is marked. It has a mark attached against it, a score. So basically, as a recruiter, when you're recruiting, you are looking at the person's specification and you're looking at the actual original, and you're basically ticking off if they meet the key points. Now, in order to be shortlisted for an interview, you should meet all of the essential criteria. However, if you do meet what's called the desirable criteria, always make sure you add this, because this will give you extra marks. And if it ever comes down to a decision between two people, you want as many marks as possible on your application. So from the NHS perspective, this is where you would write on the NHS job site. This is where you would write your person spec. Now, there's so many of these when working in recruitment that we've seen that where people might write, I really want this job and I'm really good at it because I do this, this and this. You have to be really, really structured in your approach to this supporting information. And you have to make it really clear that you do meet the criteria. Don't be afraid to put as much information. You've got 1,500 words, which I believe is about 3.5 sides of A4. You really need to use those words to shine and to make sure that everything that you have to offer, you have evidence, because this is your chance at getting an interview. And as I say, we're very structured, and it's very, it's a scoring-based assessment. So in terms of tips for supporting information, always use examples. It's not enough to say, I like this, or I'm good at working with people. You have to say why and give us an example of a time when you have worked with somebody. You might even have to do this for a volunteering opportunity. For example, if a volunteering opportunity has an application process and they say in their description that they need you to be good at working in a team player, you will need to give an example of when you've worked in a team and what you achieved together as a team. So you need to be very, very detailed in these examples. And don't be afraid to say how good you are. it's always really difficult to say lots and lots of good things about yourself. You kind of feel a bit silly at times, but actually this is your time to explain how great you are and why you should be taken forward for an interview. So that's if there's anything that's really important that you take forward, it's that when you come to do your applications, make sure that the area for additional information is very, very detailed and really supports the job description and person specification, because that will really help you to get shortlisted for interview.
Keiler, we've had a number of questions about virtual work experience or virtual engagement.
We've got a tab now for questions. So.
Oh, lovely. Okay. So yeah, just building on that, obviously in the chat, well, Keiler, you've been presenting fantastically in terms of what we need to do for those applications. Within that, as you're saying, and while you're catching up on the chat, because we had so many questions, this is amazing. In terms of, I've put in a Padlet there that has a number of different links to a variety of different ways that you can look to put in for different courses. Have a good look at it, because there's a number of different links in there that can relate to any one of the roles that you've mentioned today, and especially around in terms of medicine and a variety of other aspects. In terms of that Padlet, there's a variety of different alternatives to work experience available there that give you a certification for the hours spent in accessing that particular course.
I think we've got a question about, do you have to go to medical school to be a doctor in sport and exercise medicine, as the surgery really isn't a part of the role? The question makes sense, but any medical professional, yes, they have to do they have to go through the same process. I'm just thinking, if that's not something that you want to consider and you're really interested in sports and exercise, you might want to think about a career as an AHP, an allied health professional, where you can maybe take up the role of physio or possibly occupational therapy. There is prosthetics, orthotics. There's so many different ways to sort of support people within the AHP professions. So I've just seen that question there.
I'm just sorry, I'm just busy answering.
Yeah, is it better to do English Lit or history alongside bio and chemistry at A level? I think that one depends on what it is you're trying to do. If you're trying to do medicine, I know if it was a medicine, generally they like chemistry, they like sciences and maths, but each university is different, and it depends on your university. What I would advise you is, if you're thinking about your A levels now and what to choose, and you feel like you know what you want to do as a career and a profession, I would have a look at the universities locally to you and choose a variation and have a look at what they ask for, because the grades and the types of qualifications may vary. So it's always best to have a look at the universities and see what their expectations are.
Keiler, a question about volunteering to be within child nursing. What would be a good volunteering opportunity there, or a good avenue to link to that in terms of demonstrating? I think
at the moment, when you come to do your children's nursing, obviously you're going to want something that is related to children. If there's anything, we're really struggling at the moment with COVID, because anywhere that would normally offer and accept placement has had to say no due to safety, and a lot of businesses and any kind of NHS or organisations have said for safety they're not accepting maybe volunteers or people who are not employees. But I would say you may not be able to get on a children's ward outside of COVID, but it would be great if you could get some experience, even if it was in an after school club somewhere. So you're showing your wanting to work with young people, but also an experience of care that could be supporting in a nursing home. I'm talking long term, outside of COVID. Generally, if you were looking at nursing pre-COVID, you know, things like nursing homes, supporting at meal times in nursing homes, those kind of things would be really good. Supporting after school clubs or any kind of maybe sports activities with young people, just where you're showing you have a genuine desire to work with children. I would say that those were easier options. During COVID, you might struggle, and it might be worthwhile looking at some online training or online sessions that you can do. Leon, is e-learning for health, is there access to programs with e-learning for health?
Yes, so yeah, I'm going to put that in the chat as well. Tia's asked what work experience virtually would benefit an aspiring nurse in terms of for uni next year. Well, Tia, I think in terms of obviously the position that we're in at the moment and placements, and obviously looking at virtual work experience and how that would link, have a look at the Padlet further up in the chat. There's a variety of different ways that you can access the different types. And primarily, really, as we've said in terms of what Keiler's outlined, it's looking at those values and explaining how and what you've done over this last 12 months and through your life to date, and how that marries up to your passion to become a nurse or become an individual within the NHS. And that ties into, again, you know, in terms of Stella, you've mentioned about you not feeling that you are that strong in maths and so forth. There is a role for everybody in the NHS. And in terms of the variety of different access points and different ways, I would really go on the Health Careers website and explore. There's a 5-minute quiz on there that gives you an outline and takes you through some questions, and then gives you a list of different roles that may suit you. And that narrows it down.
There is another route as well, thinking from Stella, and just really she wants to be an OT or a speech and language therapist, which she's got GCSE maths and science. Stella, there are opportunities, and this is where it really becomes important about application process. There are opportunities for things like assistant roles with the AHPs. So there's opportunity for things getting into an assistant role. It might be an occupational therapy assistant role. It might be that if you wanted not go to university and take the working route, that you would maybe want to start as a healthcare assistant and then get some experience within healthcare assistant and move up to an occupational therapy assistant role when you see one advertised. And you'll have that experience of your initial role. And then it may be there are apprenticeships coming out for things like OTs and podiatry, and they're all being considered. The apprenticeship spectrum is growing all the time. So, you know, if you want to go on a slightly different route and go to work, that's a potential. Alternatively, it's just about, if you've got your GCSEs, have a look at the sort of the university website, have a look at what they're asking for OT, and you may actually be fine if you've got your English, maths and science. It depends. What each university may be slightly different, and it depends on the route, but there are more than one route. You don't just have to go to university. You can go and work and work your way through the roles, which is possible. As we said earlier, there's some EMT roles currently advertised for apprenticeships, and EMT1, and that role is the emergency medical technician role, and that can lead into paramedic. So there are pathways in, but so if you don't want to go to university, if it's definitely not what you want to do, have a think about other roles. But if it is what you want to do and go to university, have a look at the university website and look at their entry requirements.
There was a question in terms of what volunteering and work experience would be good for midwifery. And predominantly, I think for a number of one of these questions, it's obviously in this time over COVID, where we need to look at different ways of accessing. So again, look at these Padlets that I put into the chat, explore them, really look at the link that ties into nursing, ties into medicine, to whichever you feel that marries up to what you've spoken about today, and have a look at the different options there. There's a number of ways that you can explore and put, in terms of there's a variety of different ways, and the more things that you can put on your application form, the better. So there's no one that's better than another. It's about fulfilling the application form with your values and using the different tools that we've put in today and the research that you'll do after this session today. And look at how that links into your application form.
We've got a question about somebody's sort of questioning whether they would like to be a physio or a paramedic. And I think when you're considering, it's really difficult to make a decision about what you want to do as a career that you assume you'll do for the rest of your life. And I think before you sort of make any decisions, you can go online and there are videos that talk you through a day in the life. So there are a lot of videos on things like YouTube through Health Careers that have a day in the life of this physio. You can go on to your ambulance trust, your local ambulance trust, and ask if they may have some on their website. And it should give you a bit of a flavour about what a day in the life of that person looks like, because those two roles are very, very different. And so I think once you figure out when you watch them which is more aligned to you, then I think you should know from looking at, and try and do as much research.
I've just obviously there was a question about a healthcare scientist, and sort of obviously the conversation that I had earlier with Keiler. You may want to look at an EMT in terms of the ambulance service. And then there's other aspects around obviously a healthcare assistant role. There's a variety of different ways that you could look at that. And I've also again put a link in via the Health Careers in terms of that EMT role, if you like. Again, as I say, we're getting another aspect. What work experience would you recommend for cardiology? It was go onto the Health Careers website, have a good look at that position, see what marries up with cardiology, and then again it goes back to the types of person and opportunities that you can put within your application form to demonstrate how passionate you are about cardiology, or whichever role that you feel you need to move or want to go towards.
Yeah, it may be that you don't have experience of cardiology because it's extremely difficult to get, but it may be that you've got experience of caring for individuals in a totally different environment, as I said before, whether it be currently in the current situation, whether that be taking food packages to older people in your community and leaving them at the door, with an organisation. If there's things like that happening in your community, it might be that you demonstrate your caring nature through that way. But then maybe you've done a project at school or college that is related to cardiology to show your interest and explain what you did and how you did it. You're not always expected to have the exact experience of the role you want to go in, because some roles are just not accessible, but it's about showing some experience in health and social care as a whole. No medical research to sit outside. Allied health professionals are things like we've got physical, speech and language, OT, podiatry.
I would look at informatics. I'd look at informatics from that side of things as well. There's information around medical researching to do with medical informatics.
So hi Leon and Keiler, I just want to let you know that this is officially the end of the session, but if you're happy to stay around, and we really appreciate you giving up your Saturdays to speak to our students. I don't think there's another session immediately afterwards, so happy to stick around. If there's any more questions, please do feel free to answer them either on the video session, which will be recorded and will be uploaded afterwards, or in the chat.
Yeah, I'd just like to say thank you very much to everybody that's taken part in the session today. Fantastic questions, and as I say, I can remain for the next 5 minutes if that's possible.
Yeah,
it's number one.
So if there's any other questions, that we've got to be a radiologist, do I need biology as an A-level? So you generally they do ask for sciences and maths. As I say, what I would always take it back to the universities that you think you're going to choose and looking at their entry requirements. Some entry requirements at university are different than other universities. It very much depends on the university that you're choosing. There are other programs that you can do. So for medical, there's also an extended program where you can do a slightly longer program. So that there are options. But when thinking about medicine, it's always best to do the research before choosing your A-levels about what A-levels it is you'll need to get into the universities you want, and making those choices based on that information, because it can be quite competitive, the application process.
Biology for midwifery.
For midwifery and nursing, it depends. That you can even go from midwifery and nursing. Again, it'll depend on the university and their requirements, but some accept the BTEC, so a lot of people go into nursing, any kind of nursing with BTEC, some go in with A-levels. So it will depend on your university, what they require from you. Again, I always go back to checking with the universities you would think you want to go to. How realistic are video or simulations for what it's like to work in a hospital? A video is a snapshot, and so every day in any job is really, really different. So what myself and Leon do on a Monday can be different every Monday, and it depends on what we've got to do, what the government are asking us to do in terms of pushing the agenda that we have to work on. And so it's the same in a clinical setting. Your role differs every day. I worked in a trust setting prior to this role, not clinically, but I did go to the wards, and every day that I went there, it was never the same, because patients are different, people are different, needs are different. So every day is different in any job, and definitely when you're working with patients and people. So I think a video is a snapshot, and it can give you an overview of what's important for the role from the professional, but experience in terms of on-site experience is always going to give you a bit more real life experience. But in times like now, where it's impossible in some places to get work experience in hospitals, I think in most places at the moment, it's really important to use your initiative and think about, write down all the videos you've viewed as well. Keep a log of the stuff that you're doing as like a CPD, because that will look really good for you. I've watched this, I've looked at this, I've done this research. That shows your level of interest.
Jenna, the 4 ethical pillars, as Keiler says, and as we can reiterate the whole of this session, it's key aspects like that. If you can demonstrate that on your application form, that's fantastic. But keep building it up, keep adding to your application form. Anything that you're doing, as Keiler says, it will add towards it and demonstrate, again, your values, your passions, your behaviours in accessing an opportunity to get the course that you want, and which will obviously result in your future career. How long are the usual hours? Well,
that depends on
there's
your
the universal
role.
question.
Yeah.
You would, again, I would look online at the particular role that you're interested in, and then whilst there's the standard hours, and then obviously that's tied into your contract, depends, you know, from Keiler and our perspective, we only meant to work a Monday to Friday, but we're passionate and we would work Saturday, Sundays, whatever hours it requires in order for that to take place within that contract to ensure that we were doing our job. But at the same time, you have your work-life balance and you would be legally bound within that contract. So it's about looking about the job spec, the job description, and looking.
Most of our clinical roles we're 24/7, 365 days of the year. So if you're working in an ambulance, you know, it's not, you can't just go home in the middle of a call. Even if you're finished, you know, the patient comes first, and you have to work within sort of those kind of requirements. And as I say, the NHS is a 24/7 organisation, so it depends on your role, but some of the roles are 24/7.
Just the doctors, physiotherapy fits.
No, psychotherapists come into that. I don't know.
Sorry, have I missed that one? Sorry.
Sorry, psychotherapists come into, I don't know, into, I think if you're looking under psychological therapies, so we've got the psychology, the PWPs, the high intensity therapists. Or are you thinking about medicine and psychiatry? I think we've got a question further up that's talking about specialist training program after university, and the ethical pillars of medicine look good in an application. What I would say is, if you're thinking, I think your specialist training you're talking about after you've done your medicine degree, I would suggest that I think there's a medicine specific talk today, and I would certainly suggest sort of asking those questions to some of the more experienced doctors, as myself and Leon, whilst we're sort of careers focused, and we can give you a general overview of the careers and the requirements, and we can give you advice. We can't always give you the very, very detailed information that you would need about every role. And it would always be better to, maybe if you're thinking about medicine, to ask some of the doctors, maybe who are presenting today.
I've got about 150 different windows open here looking for different links and opportunities for you.
Psychological well-being. So psychological well-being. So we have, I'm not sure if I'm talking about the right thing here. So we have the psychological well-being practitioners. That's a pretty new role for us. And then we've got the psychologists that sit slightly above them, but you've got your clinical psychologists, or you've got things called your PWPs. Now, my understanding is for the PWPs, there is a route way for that of training. So there is sometimes there are trainee PWP roles that are advertised on NHS jobs. If that's a route way that you're considering a trainee PWP role, what I would say to you is that when you see the application go live, you apply immediately, because those roles get so many applications, and before you know it, they close, because it's a really great opportunity, a trainee PWP role. It opens the doors up to other sort of more senior posts and more training. And it's a good way to get training on the job. They do generally ask, I think, for a degree for the PWP role trainee.
Okay, I think we've caught up, Keiler. I think, I think we're there. As I say, I've put in a number of links there to interlink with all the information that Keiler's been putting forward.
We've got one more question, I think. Is it likely to have to make a formal application to work in the NHS straight after uni? Yeah, if you finished university, say for example, in any role, you would have to make a formal application, the jobs would go out, but you know, the one positive thing that you have is that as a qualified clinical individual, you have, and with good grades and, you know, good experience from the wards, you'll already have so much experience from your placement rotations that you'll be able to draw a lot of information into that application form. So for example, if you've been doing a nursing degree for 3 years and you've been on placement rotations across lots of different hospitals or private sector organisations, you will have so much experience to draw upon in that application form that you should have no problem filling it out. But yeah, the application process for the NHS is always via the formal application process, and that goes for all roles, doctors, nurses, even our executives, that, you know, that we have a formal application process.
I think
yes, well, it's possible to be offered a job from a hospital that you've had placements in, but they have, if they've said we'd really like you to come and work for us, you will still have to apply formally. They may really like you and want you to go and work for them, but you will still have to follow process. So yeah, you will still have to fill in an application. They probably really want you for a job and you've been great on placement, but you'll always have to go via the route, the correct route.
I've just been in the chat, I'll say, just in terms of finding out whether or not you found the session helpful. If you could just put in the chat as well, if you're still interested in all the different roles that you've mentioned today, just mention yes, I'm still very passionate about working in the NHS and the wider healthcare sector. That would be brilliant for us, please, just as feedback. That would be great.
Or even if you're more interested now than you ever was before, that would be even better.
Oh, that's great.
Oh, that's good.
That's what we like. Brilliant. And that's key. And each things like here today, obviously the questions and so forth, and the fact that obviously you've signed on to this fantastic conference, you know, put that on your application and join that in with the rest of the aspects around how you're building this evidence towards your future career.
Yeah, so if you want to, what I would do as maybe just a piece of advice is if you put National Health Careers Conference 2020 and you actually make a note of all the organisations and the people that you spoke to, in terms of just to add it to your sort of experience. So I mean, I don't know, we've got our logo is on the top. So myself and Leon have come from Health Education England. So you can put, obviously you might want to put that you had a discussion about careers and with Health Education England, that those kind of things will be helpful.
Take a screenshot, put it as evidence. If you need to put it in anywhere, you can put that as your record of achievement. That's for aspects in terms of evidencing the evidence. Just take a screenshot of you being on the session. If you've actually popped the question in, then obviously it demonstrates that you've asked the question.
We've got a question about certificates. Do they get certificates, DJ, for joining these?
Yes, I can confirm there will be some feedback link which we sent out after the conference, and provided you fill in the feedback link.
So certificates will be sent out, I think.
So you're getting certificates sent out for the attendance on the conference anyway, so that should be helpful, definitely.
Yes, that is. What's this?
Oh, she says she's joined everyone, but she's only had one certificate. Okay, I think DJ can make a note of that.
Yeah, that's fine. This is a new platform that we're using this year, so everything gets done automatically.
Oh, okay.
You put in your email address. Just make sure it doesn't go to your junk, because I know sometimes that's an issue because we send them all out in one go. But you will definitely get a certificate. Yeah.
Okay. think that's all.
We've got a lot more people enter, Keiler. A lot more people are entering. If you have a specific question, put the question in now. No, it's gone all quiet.
I think we might have answered all the questions.
Okay. Well, from my perspective, thank you very much. It's been an absolute pleasure talking to you all. I hope we've answered as many questions as we can. As I say, I've put in, and Keiler has, a number of links in the chat. And for those of you that are just joining us, if you can scan up the chat and obviously take any of the links that you need, by all means. But as I said, in terms of this will be recorded and sent out to you, I believe. And as I say, in terms of a certificate as an attendance. So from myself, thank you very much for joining us today. And I'd also just like to say thank you, Keiler.
Thanks everyone.
Cool, many thanks.
We hope that you all go on to work in the NHS and have amazing careers helping other people.